Hey guys, so I know I haven't made a video in quite a while, but I kind of wanted to get back into this and basically talk about what I bring to clinicals for nursing school. Basically, this last semester, the summer semester that I've had, is basically just based off giving us more clinical experience and going to work out in the field. So I just want to show what I bring to clinicals. So the first two things, well, I guess it's technically three because I do the night before, is basically I fill this up with a whole bunch of water or do it in the morning and put some ice in it to keep it nice and cold because I drink a lot of water to stay hydrated, and you should be drinking water even if you're at work. It's a lot of health benefits. You can go look it up. Another is to pack a lunchbox, or depending on where you are, some places have almost every workplace you go to for clinical experience will have a break room, or you'll be allowed off that site to go get food, or they will have a cafeteria. So just depending on where you go, there are some hospitals that I would rather bring some dollars and go eat there. There are other places where they don't serve you food at all. They just serve the residents food. So I tend to pack a lunch no matter what because one, sometimes you can snack in between, and I'll show you some of the snacks that I usually bring. But I am kind of a muncher, so I like to keep things small in my pockets in case I do get hungry. But it's always good to pack your lunch in your water bottle and get whatever clinical scrubs your facility has you buy. We have to iron ours the night before, so I usually iron the night before, and usually I'll do all of mine the night before, my lab coat, and I'll go hang my shirt and my lab coat out in my car because I do wear a tank top or a long sleeve depending on where I'm going. So those are all prepped the night before, plus with any paperwork that I have to print out. But now for my clinical bag. I got this clinical bag from my cousin, I guess she would be. Basically, she works for a company, and this bag didn't get through their, like, we can sell it sort of thing, even though there's nothing wrong with it. So basically, it is a Burks bag. Is that what it is? Brooks Brothers. But basically, it's like a laptop bag. So it does fit my laptop quite comfortably. But it does have this little handle. Sometimes I usually carry it by this handle because these kind of squeak a lot, so I don't know. But basically it opens up like this. And so you have a big thing in the middle and some of these little side things. So as you can see, I got a pencil. Usually there are more pencils here, but if you work in the medical field and you put something down, somebody takes it. So it's basically what happened to the other pencils. Then we have this little side pocket. Sometimes I'll put my phone in here, so like it fits quite well in there, because sometimes we're not allowed to actually have our phone on us. So sometimes I leave it in here because most of the places are locked, or like they have lockers that you can put your bag into. So sometimes I don't have it with me because I don't actually know where it is. It's probably in my car somewhere. But a lock and a key in case that is a facility and we need to lock up our stuff. So usually that's where that goes. And then in this second bigger pocket, I have hair ties because we have to have our hair up and out of our face while we're at clinicals, and most of the time mine are lost or I forget them. I mean, understandable girl things. Another understandable girl thing. We have to wear white tops. So if you've ever tried to do anything in a white top, you are tend to get stains. So I have a Tide to Go pen just in case. I have these little notebooks. You can get these basically anywhere. I got these at the 50-cent store, and there was like 6 of them. Just to keep in my pocket because sometimes I don't want to bring the big binder that I have into patients' rooms. So this is kind of nice. Say like you walk into a patient's room and you see their vital signs are kind of on the low side. Well, you can write it down, write the time, and then write what you did to assess the patient. And then if stuff kind of goes haywire, you have your set of vital signs, the time, when all of this initially started, because you need to chart everything. I have a green pen. Not sure why. And this is kind of the other side of things. So I'm going to go through just some other helpful things. I have some menstrual relief pills, but they're just pain relievers, a diuretic, and an antihistamine. So basically, you could take it even if you have a headache, sort of thing. But basically, I have these. Usually, I have some ibuprofen in here, but I currently used it all up. So, tend to keep those kind of things in here because, one, that's not a lot of people remember to pack those kinds of things, and you always need them. Always. I do have a snack in here. This is a Larbar, but I bought it and it was on sale, so it's got this weird sticker on it. But it is a, what is it? What flavor? Cherry. The cherry Larbar. I don't know why they put these on them. The cherry Larbar, these are usually the things that I stick in my pocket because even if they get warm, they don't melt. So it's always a good thing to consider. Or the Quest bars. The Quest bars are really good too. But then I always keep some kind of lotion with me. Usually they say not to do kind of fragrancy smells, but this one, it's not that fragrancy to me. So if you ever have to go into a patient's room where it just smells bad and the patient cannot help it, or you've washed your hands for the 100th time and it's only 9 o'clock, you need this. Another thing is a gait belt. Basically, some of the facilities that we have, this is required of their employees to have. So basically, when we go, we try to basically be their employee and follow the rules of the facility. So I have a gait belt. Another big thing, so depending on what facility, or what school you go to, they'll give you a certain assessment book. So this is our little Jarvis physical exam and health assessment. This is the 7th edition, but this is the pocket edition. This doesn't fit in your pocket. I'm just letting you know. It may, but I didn't want to like rough it up. But basically, this just goes through how to look at an assessment, what to look at, words, medical words for things that you find, and how to chart certain things. So like how to look at the eyes, how to do the cardinal gazes. So if you're having trouble figuring out how to do an assessment for something, you could always look in here. Most of the time I look in here because I know how to do the assessment, but I don't know what the word for the assessment is or what I found during the assessment. So that's what I tend to keep this for. But it basically goes everything from like a head to toe assessment to focused assessments to babies and pregnant women. I use this a lot in my maternity rotation. And then now we're into this big pocket. First thing is this is my blood pressure cuff. It comes in this little cute little package. Sometimes our facilities that we go to don't have automated blood pressure cuffs. And sometimes they don't even have blood pressure cuffs in the room. So that's when we're asked to have our own blood pressure cuff. And I've had that one for years. Then I have my stethoscope. I have the MDF. I think it's just the classic. I do have a Littman. I don't prefer either or. Just that this one was quite cheaper, and I do tend to leave things like out on the counters and stuff because I really don't like walking around with things hanging off my neck. So I don't like to walk around with this on my neck a lot. So I'm just afraid to bring the Littman and then lose it. So, but this MDF, I actually quite like a little bit better than my Littman. I don't know, maybe it's just personal preference. I have really bad hearing, and a lot of people say the Littman you can hear better on, but this one I can hear better on. So, I don't know. I'll leave a link to where I got my little pocket organizer in the comments down below. I got this one off Amazon, so I'll basically just show you what it came with. It came with a little, like, badge holder thing. Well, we're not allowed to have our badges on a zip line thingy. There's just like a little clip thingy. So it came with that. It has this little pocket here that I've never used before. So it kind of opens up like this. And it's just like a little pocket. I've never found a use for it because I usually keep this in my leg pocket. So, I don't know. It does have this little back pocket, and sometimes I keep cards or alcohol prep pads in there. So, I got tons of those. Does come with a pair of hemostats and a pair of bandage scissors. And then I will also, these I got off Amazon. This is a pen light. What are these called? Everbright. Came in a pack of 4 with batteries. And this thing can light up a room. I use this especially in the nursing homes because a lot of the nursing homes don't have the best lighting for like wound care, stuff like that. So I've absolutely loved these. This one I think came with a pen light, but it was just so dim, so I just went and bought these, and they weren't that expensive, and I'll also leave those down below. And then I have 2 pens. One has a highlighter because I do like to highlight a lot of the stuff that, like, when we're writing a report, like when medications are to give, or when I'm given a medication, I'll highlight it. Just stuff like that. And then I have a Sharpie because if you do any sort of wound care, hang anything up, you always have to, write on it. And Sharpie does not come off, as where pen can be kind of removed a little bit. So most places prefer you to write a Sharpie. So I have a Sharpie for that reason. And then I don't think there's anything else in this little thing. No. Just a lot of alcohol prep pads. Okay. The last kind of big thing in here is this clipboard. So I have loved this clipboard, and I use it also at work as a CNA. This thing gets washed quite much. It's like that plastic kind of material, so it's easily wiped down. So you can clip whatever you're working on. I always tend to clip some, like, all the stuff down and then a blank sheet of paper on top, because I am known to just, like, leave this on something outside of the room or on a cart, and you never want patient information. It does have a pretty big center compartment. This does hold, like, this little jarvis book can fit in here, and you can close it. So I don't know if you can see that jarvis book, and you can close it quite comfortably, and it can sit in there. So in the beginning, when I was really focusing on assessments and getting my assessments right, this thing came everywhere with me. So, but now I just, a lot of our clinical sites, we have to have clinical paperwork to post afterwards. So I tend to keep a lot of that stuff printed off in here for wherever I'm going. A lot of our sites are now precepted sites, so our teachers aren't there with us. So it's basically us following a nurse around, and she's kind of the boss of us for the day, or he, whichever one. And so we have to keep up with some paperwork that they have to sign at the end of the day, basically just assessing us and how we did. So I keep a lot of that in here just so I don't lose it and keep up with it. And also, if there's some downtime in the day and I can answer some of those questions that we have to answer, I can start filling it out, handwriting it, and then come home and upload it. But yeah, that's basically all I keep in my clinical bag, and basically all I do for clinical. We go to so many different clinical sites, so it's really hard to say, like, just for one set of clinical sites, like, what to expect, because every place is different, every state is different, every hospital, every nursing home, every mental health facility, they're all different. So basically, I just try to prepare the best for me, knowing what I need to do to be successful today, and that's basically bring snacks and water. That is everything that is in my clinical bag. I do plan on making a few more videos just basically kind of talking about mental health. We've had our first test and it's gone great. But sorry for taking another break. It's been crazy. And I'll do an update video after this. Bye guys.